Several changes are coming for people traveling out of country. At the end of this month, fully vaccinated Canadians will no longer need to take a PCR test to return home. Instead, they can get back into the country with a rapid test taken within 24 hours before their flight or drive across the border. As well, unvaccinated children under 12 years old with fully vaccinated parents will no longer have to avoid schools or daycares for 14 days. People can still be randomly selected for PCR testing upon arrival, but they won't need to quarantine while waiting for results. Jean-Yves Duclos is the Minister of Health. He's in Ottawa. Minister Duclos, welcome back to the show.
Hello, David, and hello, everyone listening.
So, Minister, we know rapid tests can be useful, but we also know they're not the gold standard, and there is some potential for false negatives, false positives. So why keep a testing requirement for travel but move to this lower standard?
Well, for three reasons. First, because now the situation in Canada is becoming better. Now, there is still some progress to be made, but now things are under greater control. Now, the rate of hospitalizations has considerably fallen over the last few days and weeks. And second, we know that now pre-departure tests are effective. What we hear from public health experts is that there are, as you said, advantages and disadvantages to using either antigen or PCR tests. But antigen tests used the day prior to leaving Canada have a level of precision that is deemed to be sufficient and acceptable.
Okay, and presumably they're cheaper and they're more plentiful, so they're easier to get. So that eliminates some of the issues with PCR testing. But, you know, Minister, there are still businesses that have been really hard hit because of this, that rely on travel, rely on tourism. And they argue that even a rapid test is still an unnecessary impediment and will continue to hurt them. And what would you say to businesses who are worried about even this level of testing requirement being a net negative for their bottom line?
Well, we know it's tough for a lot of people and industries and workers, and especially the tourism industry now, and it's been the case for many months now. The objective of all those measures is to protect the health and safety of travelers and workers, airline workers and airport workers and others. So we know that there is still a significant level of positivity rates when people board a plane, despite having been tested negatively prior to leaving, to coming back to Canada. So we need to protect those workers and those travelers. And one essential way to do it at this particular point is to have pre-departure tests of the antigen or PCR types.
But if there is still a significant percentage getting on the plane who are positive with COVID, why move to the less reliable method of testing? Why not just stick with the gold standard, the PCR test?
Well, it's always a trade-off. As you said, PCR tests are what we call more sensitive, but they can be taken up to 3 days before coming back to Canada. Rapid tests are a little less sensitive, a little less precise, but we're asking them to be taken not more than 1 day prior to coming back to Canada.
So I wonder, sir, if this is subject to change. I mean, what data will you monitor to make sure the rapid antigen tests are the right way to go? And what would it take for you to roll it back, to move back to the PCR test? Or are we just moving in this direction of lowering the testing bar?
Well, you're correct. Monitoring is a key word in this exercise. It's exactly what we will be doing and continue to do. You're exactly correct. Now we are going to allow for those two types of tests, and we are going to keep a random level of post-arrival testing, PCR type testing, which is going to give us evidence on the reliability of these types of two tests, and we'll see as we move forward.
You know, this is a reduction in the requirement for vaccinated travelers coming back to not have to get a PCR test, but there's also some pressures and calls to eliminate the need for testing entirely for short trips, for example, to the United States. I mean, what would it take to get to the point where your government will consider dropping the testing requirement for short-haul travel to the U.S.?
Well, two things. Briefly, you're correct. These changes, this easing of rules and facilitation and increase in the speed of tests, that only deals with vaccinated travelers. The rules for those that are not vaccinated are not being changed. Now, regarding other adjustments, such as the rules for those that travel outside of Canada for a small number of days, we'll continue to monitor the situation and see as we move forward what is the best thing to do, both to facilitate everyone's life, but also to keep protecting the health and safety of everyone.
You know, you're making these changes at the federal level. We're seeing province after province rolling back restrictions at their provincial level or dropping mandates entirely. All the while, there are protests happening right across the country. I know you say this has nothing to do with the protests and the unrest, When you look at the timing of this, though, lining up with the protests, are you not worried you're handing a victory to the people who are camped out right outside the building you're sitting in right now?
Two things again. First, the changes that we are announcing today have no impact on the rules for unvaccinated travelers. So these rules have not changed and will not change, at least in the foreseeable future. All the easing and the adjustments of the measures we announced today deal with those that are fully vaccinated. Now, regarding the timing of that announcement, we've been following the situation since the beginning of December with Omicron, obviously looking at daily, weekly numbers around the incidence, the number of new cases, the number of hospitalizations, number of deaths, the positivity rates for those that have traveled into and out of Canada. So all of those numbers obviously have been entering for many, many weeks. So there is, I think, no one listening to us today that would pretend that we've been looking at those numbers only in the last 2 or 3 weeks.
But, you know, looking at numbers and looking at metrics, the Conservatives are calling for a big plan or a roadmap from the federal government to present a plan to end all of the federal vaccine mandates or restrictions that are out there. And I know the motion that was tabled yesterday by the Conservatives was defeated, but at some point, sir, don't Canadians deserve to know what the general plan is when it comes to a return to a more normal life, like a blueprint with metrics that they can look to and count on to know when things can start to change?
Well, we're all tired, and we would all like to decide and dictate at which date COVID-19 is going to end. But unfortunately, that's not how the virus works, and that's not what science tells us either. This virus has led to many surprises over the last 22 months, and it will keep surprising us over the next weeks and months. There will almost certainly be new waves and new variants. We need to be prepared for that. So to claim that on a particular date we can end COVID-19 is, I think most people will understand, not sensible. So we'll continue to do what we need to do, which is to protect the health and safety of everyone, and do that in a way which evolves as the situation also evolves.
But not a particular date, sir, but a particular set of circumstances, you know, certain benchmarks of case levels or wastewater levels or positivity levels. I mean, I know there's a lot of uncertainty, but we still get regular modeling from the Public Health Agency of Canada giving us an idea of where things are going and how we should adjust ourselves accordingly. Can we not see a plan as to when, you know, if things get to a certain lower threshold, we can start to ease up a bit?
That's a great point. It's exactly what we're doing today. Now, both based on that modeling, the recent numbers that we've seen, projecting into the beginning of March. Now, these measures that we're talking about today are going to be effective as of the end of February, the 28th of February. So we use all of these numbers, not only to, as I said, to adjust the measures as the situation evolves too, but also, as I said, based on science and prudence, always be mindful of the importance of protecting the health of everyone.
Okay, Minister Duclos, thank you so much for your time.
Thank you, and everyone have a great evening.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.